He's like, well, what are your topics? I said, well, the hospice flexibility. He obviously knows way more than I do, but patients choosing Medicare's hospice benefit at the end of their lives have traditionally had to give up most curative care. Under Medicare's new care choice model, patients with a terminal illness will be able to receive hospice services without giving up treatment. A cancer patient would continue to get chemo, for example. Well, I'm talking waxing poetically, and he goes, he called me Boop, but my name's Michael Regan. He goes, Boop, that's only 70 hospices. You know, it's not like national. It's not a national movement. So I am proud to introduce my brother, who is truly a hospice expert, Wayne. He is with Simeone Healthcare Consultants. They are based out of Hamden, Connecticut. I actually grew up with the Simeone family in Cheshire, but his office is 1700 West Park Drive in Westboro, Mass. Wayne, welcome to the show.
Thanks for having me, Michael.
All right, my pleasure. All right, so take it away. I mean, really, you're the hospice expert. And the reason you're listening to this is because, unfortunately, this is a Medicare and You show, and it is not just about Medicare and Medicare supplements and Medicare Advantages. It's about the whole Medicare process. So I really do have an expert. If you need to grab a pen, go ahead, because he's going to be filling the airways with information. All right, so I'm just going to leave this up to you. I'll interject back and forth with some insurance points.
Sure.
But you take away what you think.
So hospice is truly it's quality and compassionate care at the end of life. It's typically utilized in life-limiting illnesses, and it's a team or collaborative approach to providing care. Your physician, the medical director of the hospice, a RN case manager, social worker, home health aides, volunteers, counselors, and there's a bereavement program because hospice just doesn't end when the life ends. Bereavement follows the hospice family for 13 months post-death. But hospice is about dying with dignity. It's about pain and symptom management. It's focusing on palliative care or what goals of care. How would you like to see your last days of life happen? It's about assisting with the psychosocial aspects of dealing with serious or a fatal illness. It's having counselors come in and assist you with what you would like to see, and it also assists with advanced care planning, which you talked about last week.
Right.
Interesting component that Medicare now pays physicians to have that conversation, advanced care planning. So your own physician should be encouraging you to talk about end of life, and in a good time to talk about it is now. There is no perfect time because typically hospice has a short length of stay, unfortunately. It's a 6-month benefit, but we're seeing some different models of care throughout the country where they're expanding that benefit length. One example is Blue Cross Blue Shield of Massachusetts is looking at expanding that from a 6-month to a 1-year benefit. And I obviously applaud what they're doing, and we are actually going to be working closely with them on that. But hospice can be provided in your own home. It can be provided in a skilled nursing facility, can be provided in an assisted living facility, and then there are hospice residences or inpatient facilities that provide hospice care. And those are typically shorter length of stays when folks are really have seen a decline in their illness, and we see patients reside in those at the last typically 5 to 10 days of hospice. There are 6,100 hospices throughout the country. As you mentioned earlier, Michael, there is a new program called Care Choices, which is a Centers for Medicare and Medicaid demonstration project, but only 70 hospices have applied for that demonstration and have been approved to provide curative care while you're on the hospice benefit. And so what that would mean is that somebody could still continue to see their oncologist or their nephrologist and get curative methods of hospice care, because typically when you go on hospice, you're not allowed to go in for curative programs.
Right. That was a past, not a law, but it was a past practice, I think.
It's part of the conditions of participation, as they call it.
Okay.
So, but as I said, in 2014, 1.7 million folks died on hospice. So we're starting to see the hospice benefit be expanded, but people don't understand that hospice is palliative care. It's all about pain and symptom management. It's all about focusing on those goals of care. And as I said, it's a 6-month diagnosis or prognosis of 6 months or less. And then there's what they call the local coverage determinations, which assist a physician on determining hospice eligibility. Not everyone is eligible for hospice, and there are certain diseases that typically align themselves with the hospice benefit, and but not everyone does qualify for hospice. So you have to see a decline, and then 2 physicians, as we said earlier, has to sign off on that decline and then do what they call a certificate of terminal illness. You can go out of hospice care. You asked that earlier in the beginning.
Right.
Patients do see a rebound effect because we start pulling away some of the medications that we're not worried about your cholesterol level typically when you're at serious illness. So we'll pull some of those things away. We do see a lot of pain and symptom management because at that end of life, we'll see higher titrations of medications, and the hospice certified folks have a much better handle on managing that process. So what we're seeing is, it's not just a small cradle industry like it first started. It first started with Dame Cicely Saunders at St. Christopher's Hospice in England. And then the first hospice was here in in Connecticut, down in Branford. And so it's kind of a local benefit that occurred in the state of Connecticut, which is kind of interesting. So unfortunately, as we said, it's a 6-month benefit, but the average length of stay in a hospice is only 71 days. And the median length of stay, or 50% of the folks that get admitted into hospice, stay for only 17 days.
It's that quick, huh?
It's unfortunate. And so we would love to see that conversation move upstream. We would love to see patients and families have that difficult conversation saying, hey, what do you want to do when you get to a point where we know death is imminent? And it's a good conversation to have at any time in your life because advanced care planning is important to all of us.
We have to take a commercial break to plug the sponsors. Can I ask, would you stick around at least for 5 or 10 more minutes?
Sure.
Okay, callers, obviously you're going to have questions on this topic, 757-1320. We'll be back in a few minutes after we plug the sponsors.